Asthma is a chronic inflammatory disease of the airways that is associated with acute episodes of airway obstruction, which in some cases can be severe and even life-threatening. The symptoms of asthma can include wheezing, shortness of breath, chest tightness, and coughing. The causes of asthma are complex and dependent upon an interaction of genetic and environmental factors, such as infections, allergens, and air pollution. A characteristic feature of asthma is airway hyperreactivity, an easily triggered contraction of the airways. In an acute asthma attack, airway hyperreactivity leads to smooth muscle spasms or contractions and airway narrowing. Edema of the airways and mucus plugging also leads to narrowing of both small and large airways of the lung. As a result, breathing becomes progressively difficult. The clinical symptoms of asthma are the result of the action of many different immune cell types and inflammatory mediators inside the lung. One of the key cells in this process is the T cell. T cells are activated by dendritic cells and other cells in response to environmental triggers. Once activated, T cells secrete cytokines such as interleukins 4, 5, and 13, which cause different aspects of asthma pathology. Interleukin 5 draws eosinophils into the lungs from the circulation and activates them as well. Upon activation, eosinophils release toxic mediators that can cause injury to the airway mucosal lining. The release of interleukin 13 leads to the proliferation of fibroblasts and smooth muscle cells. In addition, interleukin 13 acts on the epithelial layer of the lungs to generate goblet cells. These effects result in changes in airway structure, known as airway remodeling, and may include increased airway wall thickness and increased mucus production. T cells also produce interleukin 4 that enhances IgE antibody production from B cells. These antibodies then bind to mast cells, which prepares them to respond to allergens, further exacerbating the immune response. All of these inflammatory effects increase airway hyperreactivity and can increase the potential for an asthma attack. The goals of asthma treatment are twofold: to provide immediate relief of bronchoconstriction in the acute setting and, over the long term, to control airway inflammation. J&J 385-18168 is a novel anti-inflammatory drug that is an antagonist of the histamine H4 receptor. The receptor is activated by histamine, and the drug blocks this activation. The H4 receptor is located on the surface of many of the inflammatory cells found in lungs and implicated in asthma. In particular, it is found on dendritic cells, T cells, eosinophils, and mast cells, and has been shown to be involved in both the recruitment and activation of all these cells. In asthma, T cells and eosinophils are recruited to the site of inflammation in the lung. This is partially mediated by the H4 receptor. In addition, the H4 receptor increases the functional activity of these inflammatory cells. Activation of the H4 receptor increases IL-4, IL-5, and IL-13 production from T cells, leading to mucus production, bronchial constriction, thickening of the muscle layer, and other long-term changes in airway function. When patients with asthma take J&J 385-18168, the drug will bind to the H4 receptor and block the binding and activation by histamine. As a result, both the recruitment and activation of inflammatory cells should be reduced. This reduction in inflammation should improve airway function and make it easier for patients to breathe. J&J 385-18168, a novel H4 receptor antagonist, being developed for the treatment of asthma.